Okay. Every drop of blood through these tubes means a better chance at life for Don Mayberry. Don has sickle cell anemia, a blood disease in which some blood cells become deformed. The sickle cells carry oxygen to the organs just like a normal cell, but once they drop off their load of oxygen, they become inert, blocking the passages to the organ. Don is unable to walk because of sickle cell blockage in his hips, so he has to have surgery.
How are you doing, Don? Okay.
But sickle cell anemia cuts the oxygen-carrying capacity of the blood in half, so Don's body has to work twice as hard just to supply enough oxygen to keep him alive. In the stress of a surgery, Don could easily die. That's why this elaborate transfusion is so important.
This will allow him to go through his surgery and recuperate from his surgery by having normal blood in his body. But after about 2 months, his own red blood cells will replace the blood that we've put in. You can see how the cells are sticking on the side. What I'd do is I'd go ahead and start your next pass because
Don's sickle cell-infested blood is drawn out and healthy red blood cells put back in. The procedure will replace nearly 70% of Don's blood and get rid of his sickle cells. Sickle cells have never been isolated and removed in this way anywhere in the state, and Don Mayberry feels pretty good about being the first patient.
They are going to do some research, and I want to help somebody else, help them to find out, more about sickle cell.
Don's mother stood by him for the entire 4-hour procedure. She and Don both know that all this elaborate work won't last forever. Within about 2 months, Don's blood will be as full of the deformed cells as it was before the transfusion. But by then, the surgery will be over. Don will be able to walk again and have a better chance of living with sickle cell anemia than anyone has ever had. The first step, of course, is to find a donor. It takes about 5 minutes to donate 1 unit of blood, and a healthy person can donate a unit every 56 days. This bag of blood isn't just set up on an IV pole and plugged into someone else. Whole blood is rarely used for infusion anymore. It's separated in a centrifuge to yield its 3 component parts. This is plasma. In surgery, it's used to keep up fluid volume and prevent infection. Red blood cells are the second blood component. They carry life-giving oxygen throughout the body, and platelets enable the blood to clot, but they can live only 72 hours outside the body. Bobby Buck needs platelets and plasma. He has a disease which lowers his immunity and his body's ability to clot blood. Fresh platelets and red blood cells must be available when Bobby or anyone else needs them. And on this holiday weekend, hospitals will need a lot. Hospital blood supplies are good for now, but you never know what will happen. One person in a serious car accident can use up to 10 units of blood. Officials at this blood bank say there isn't enough blood on hand to get through the weekend. So try to take care of yourself this holiday, so these folks can use what blood they have for somebody else. Sue Lauer, Action 4.
Hi, you're interested in soft contacts?
Yes.
Extended wear or daily wear lenses?
Extended wear contact lenses are fitted to your eyes just like any other kind of contact. The optometrist measures the curvature of the eyeball by taking a photograph of the eye on a special camera. No 2 eyes are the same. In fact, the shape of the eyeball and the pattern of the striations in the iris are as individualized as a fingerprint. The lens is made of a special plastic which is hard when dry. It's ground to the exact specification the patient needs, and then it's hydrated or soaked in water. The wet lens retains the unique curvature and prescription, which matches the patient's eye.
The reason that an extended wear lens can be worn for long periods of time are two. One is the way that the lens is made. It's designed a little better so that you can get better oxygen flow, better tear flow between the lens and the eye. And the other thing is it's made of materials which are highly permeable to oxygen. The cornea, unlike tissue found anywhere else in the body, does not receive its nourishment from blood supply. Most of its nourishment, we feel like, comes from the tears themselves. And if you put something on there which blocks the cornea's access to tears, therefore you block its source of receiving nourishment, oxygen, and food.
The extended wear lens is about 75% water, a higher water content than a normal soft lens. This allows the eye to breathe. The lens can remain on the eye for weeks at a time, but it should be cleaned by a doctor about every 2 months. And you should know that extended wear lenses don't last quite as long as soft lenses. You'll need to replace them nearly every year. Anesthesia is an important part of major surgery. The patient is given a special combination of drugs which reduces muscle tension, evens the respiration, and puts the patient to sleep. But perhaps the most important aspect of anesthesia is that it deadens pain and makes surgery possible. Pain-killing drugs have become a part of our everyday life, an accepted element of almost any hospital procedure. But some people prefer not to use drugs for their pain. They want to be awake and aware during surgery or childbirth. They're looking for another way to control pain. And for these people, the answer is all in their mind. This woman is teaching herself to ignore pain through hypnosis. She's working with Dr. James Kimball, an Oklahoma City physician who uses hypnosis to help women through childbirth. Women learn to turn off pain in certain areas of their body through a technique called glove hypnosis, and these ladies came to see the technique in action. Dr. Kimball pinches the subject. In her deep trance, she has consciously blocked out all sensation in her right hand.
Pressure but not pain.
Then Dr. Kimball inserts 2 surgical needles in her hand. The subject doesn't wince, doesn't move. In fact, she said later, she didn't even feel it.
And one nice thing is you don't have to use any medicines when you're being hypnotized, so you don't have the side effects of the medicines. And people get a sense of self-satisfaction with having conquered discomfort or whatever by themselves, maybe with the help of the hypnotist, but they've done it themselves.
Booths are all over Shepherd Mall. Many are informative displays about health care, job opportunities, and community health care facilities.
Has anybody in your family ever been diagnosed with diabetes or with glaucoma?
Diabetes screening takes only a few minutes. A tiny blood sample is taken and tested for blood sugar levels to find out if you need to change your diet or consult a physician. Cancer screenings are new this year. Technicians inspect for all kinds of cancer. Here they're looking for skin cancer and oral cancer. The Mayor's Health Fair is just about the only place in town you can get a complete physical for free. Sue Lauer, Action 4. When temperatures top 100, most of us head to the nearest swimming pool. Cool water will help keep your skin moisturized, but chlorine can dry your skin, and the sun will finish the job, leaving parched skin that's more susceptible to sunburn. That's why sunscreens are especially important now. Even if you have a good base tan, your skin needs moisture to protect it from drying and wrinkling. There are a lot of sunscreen products on the market, and it's hard to choose which one is right for your skin type. The higher number offers a better sunscreen protection, but there are a few other things to look for.
And probably the most effective is a chemical known as para-amino-benzoic acid, or short is PABA, P-A-B-A. That is probably the single most important ingredient in a sunscreen. The other aspect of that is, what is the sunscreen made of? That is it a cream base or an alcohol base? For instance, a person with acne who wants to protect themselves also against the sun should use an alcohol-based sunscreen rather than a creamy base, so that they don't aggravate the acne. On the other hand, a person who has a tendency to very dry skin would want to use a creamy base.
Whatever type skincare product you choose, it doesn't do any good unless you apply it often and thoroughly. A good coating of sunscreen will help you get a better tan and keep your skin smooth and soft. Biofeedback is simple. Even a child can learn. In fact, some children respond better than adults because a child's thought processes are simple. But children suffer from stress, anxiety, and hyperactivity just like grown-ups. Jennifer is learning to control her stress levels by regulating body temperature and skin response. This machine measures the tiny electrical changes. When Jennifer slows her reactions, the train goes around the track. When she tenses up, it stops again. Soon Jennifer will learn how to turn off tension without the train, a skill which can help her learn better at school.
The equipment is designed to get the person off it. So the person uses it as a tool, and then once they've gained control over that, then they move away from that. Occasionally they need some follow-up. They come back to sort of refresh their knowledge in using that skill.
Like any learned skill, biofeedback takes time, but many patients would rather take time than drugs. Biofeedback has been successful in helping patients overcome stress, tension headaches, low back pain, stuttering, and some learning disabilities. It's self-help medicine, only as good as the patient's desire to make it work.
Most people can learn the biofeedback training. The difference is in the motivation. You have to have a highly motivated patient, someone who is willing to devote the time and effort to really learn the training. This is something that's somewhat different from what we normally see in a medical center setting. Instead of something being done to the patient has to take a very active part in the work and really work to learn the training.
This sparse examining room is like a second home to Althea and Brandy Leatherwood. They've been coming here since 1976. That's when doctors discovered they had cystic fibrosis, an inherited disease which has no cure. Like all CF patients, Brandy has trouble breathing. Thick, ropey mucus clogs her lungs and digestive tract. She coughs a lot and has a hard time gaining weight. Respiratory infections and digestive problems come and go like a common cold, wearing down her resistance a little more each year. Working in hot weather like this is no fun, and it can be dangerous. We're not talking about a little perspiration and a heat-related headache. Heat sickness can kill, and in Oklahoma, that's something to think about. The best protection from all kinds of heat sickness is simple. Drink plenty of water. Your body needs fluid to sweat and to keep body temperature down. So up your water intake about 2 glasses a day during the heat wave. Heat sickness can be a medical emergency. Doctors see 3 kinds of heat sickness: heat stroke, heat stress, and heat cramps. While heat stroke is by far the most serious, heat cramps are the most common.
What we're seeing now is really heat cramps and heat stress. Now, heat cramps, that individual, sort of an athlete, he goes out and he plays tennis or he's jogging in this hot weather, and one should certainly curtail it in this hot weather, and he drinks a lot because he sweats. But when you sweat, you're losing both salt and water, and when you drink water, you're only replacing the water, and you're losing your sodium, and so in that situations, the people end up with cramps, both in their legs, the cramps in their abdomen, and it's sort of easy to treat, of course.
A little extra salt on your food is about all you need to replenish the salts lost through sweat. Doctors do not recommend salt pills. They have problems of their own. Just a couple of extra shakes of the stuff on your dinner should do the trick. This sparse examining room is like a second home to Althea and Brandy Leatherwood. They've been coming here since 1976. That's when doctors discovered they had cystic fibrosis, an inherited disease which has no cure. Like all CF patients, Brandy has trouble breathing. Thick, ropey mucus clogs her lungs and digestive tract. She coughs a lot and has a hard time gaining weight. Respiratory infections and digestive problems come and go like a common cold, wearing down her resistance a little more each year. Brandy is only 9 years old, victim of a disease where few live past 20. Terry Vinson is an amazing exception. She's 23, and she's been living with CF since she was 7. Medical science has been fighting the battle against cystic fibrosis for years. There's no victory, no answer. Terry has outlived the predictions, but still there's frustration and fear. No matter how hard she fights, the disease always wins.
I put my trust in God, and I know when I have problems or stuff, I'm learning that I can put my burdens, give him the burdens, and he sees me through everything, so I don't worry about it.
Terry Vinson relies on God, but researchers at the Health Science Center depend upon years of investigation. Finally, scientists have been able to make animals display some of the symptoms of cystic fibrosis found in humans. That's like finding the last piece of border in a jigsaw puzzle. The animal model is a framework, and scientists are now able to work backwards to find what genetic and chemical factors triggered the disease.
The hope and implication of our research is that by developing some animal models of the disease cystic fibrosis, that we will better understand how this disease occurs, what causes the problems that these children have, and our ultimate hope is that it will lead to better treatment and a cure of this disease.
Researchers are well on their way to finding a cure for cystic fibrosis. The answer may come in the next few years. That's good news for future generations, whose children may never have to worry about cystic fibrosis. But for people like Terry Vinson, a few years from now may not be soon enough. For Medical Matters, Sue Lauer, Action 4. Any avid jogger can tell you running is an addiction, rain or shine, whenever they can find enough time to throw on the shorts and shoes and hit the street. Strenuous exercise puts a strain on your body, and sometimes there are problems. Sore feet, falling arches, cramps, pulled muscles, they're part of the game. But when the running rhythm is thrown out of whack, joggers want a doctor who understands.
Hi, Herb. How you doing? How you doing? How's the running coming along? I'm pretty good. I'm having some pain in my arches, though, when I run.
A jogger's feet are his fortune, and when they hurt, it's a no-win proposition. Proper shoes are important, but so is proper care. Tom Caniglione knows. He's a jogger. He's also a doctor. And a couple of afternoons a week, he and other sports-minded physicians staff a runner's clinic. They see everything from too tight shoes to toe fractures. The Jogger's Clinic provides good medical care for runners, and something else that's just as important,
a runner can understand a runner much better than a non-runner can. And the biggest problem you have with a runner and an injury is that the runner does not want to be told to stop running. If he hears that from a real runner who's also a doctor, I think it might mean something that's a little bit different.
Dr. Caniglio tries to keep his patients running as a part of their treatment. That's because he knows taking care of a runner's addiction to running is just as important as taking care of their body. For Medical Matters, Sue Lauer, Action 4. You might say these feet look like just about any pair of 12-year-old feet. Several doctors in town would agree with you. But Craig Troyer couldn't run. His ankles buckled inward. Friends said he ran like a duck. Craig's parents didn't quite know what to do, so they took Craig to the runner's clinic here in Oklahoma City. Doctors there helped design a special orthopedic wedge that fits inside Craig's shoes. It holds his ankles high, so for the first time in his life, Craig can run just like the rest of us. And that little piece of cork and leather has changed Craig Troyer's life.
Of course, you always want your child to be normal and look like every other child, and I think basically we've always felt that Craig felt a little bit left out in not being as athletic as the rest of the children, and we're hoping now that he can run and walk a little bit better, that possibly he'll feel a little bit better about himself.
Well, the kids don't make fun of me on the way I walk.
Is that pretty important?
Yeah.
Doctors at the clinic put Craig on a treadmill to check his stride. They're amazed at the progress. Craig's gait is almost normal, and his ankles used to almost brush the floor when he ran. Now Craig is ready for the big time, thanks to a couple of doctors who took the time to listen, and a hunk of cork and leather in his shoe.
Right now I can't run very far, but after a couple of years I might be able to run like a 5-mile race or something.
You think you'll win?
Maybe.
A simple eye examination can tell you whether or not you have pink eye. It's a viral infection. The germs are always around, just like a cold or flu. But for some reason, doctors are seeing an alarming number of cases this summer. Pink eye is highly contagious. It's passed on by physical contact, through coughing or sneezing. Symptoms are flaming red eyes, burning, and blurred vision.
The eyes should be cleaned carefully with clean water 3 or 4 times a day. Cool water will make the eyes feel more comfortable. There is no antibiotic drop, unfortunately, that will stop the infection, and the body's own defenses will clear the infection in 2 to 3 weeks. It is exceedingly infectious for about 10 days to 2 weeks after the first symptoms occur, and it's necessary to avoid contact with other patients or with other employees for 10 days after it occurs.
There have been so many cases of pink eye that doctors are calling it an epidemic. If you think you've been exposed to anyone who has pink eye, if your eyes burn or if they're red, go see your family eye doctor. For Medical Matters, Sue Lauer, Action 4. Feet aren't exactly beautiful, but they're pretty amazing. The average pair of feet will carry its master more than 65,000 miles in a lifetime. That's if you don't jog. Most of us don't even bother taking much care of our feet, and you shouldn't have to if you wash your feet daily, keep them dry, and wear comfortable shoes. But there are days when your feet just kill you. Actually, it's the other way around. Feet need protection from stylish high heels and hard concrete. A cushioned insole pad can work wonders. Corns and calluses are common problems. A corn is simply a small callus with a hard central core. It's usually caused by ill-fitting shoes. If you can't change the shoes, try a corn pad or a special product to dissolve the callus. But sometimes drugstore products can't help, and surgery is the only answer.
Where they become very severe, where their pain is chronic and they can't wear shoes, then it's nearly always caused by some bony prominence or a spur, and then they need surgery to remove that portion of the bone that's causing the corn.
Shoes cause lots of problems. Lightweight shoes will help reduce perspiration, and that cuts down on foot odor. Leather shoes are usually the best because they allow your feet to breathe, but they will retain moisture, so it's a good idea to alternate shoes and allow them to dry between wearings. Plain old talcum powder in your shoes will help cut down on moisture too. Natural quartz crystal, prized for its simple beauty. Ancients believed the crystal housed psychic energy for healing and cleansing the soul. Dale Walker believes today he uses quartz crystal to focus the body's innate healing power, the psychic aura. The power isn't something you can just talk about. It needs to be experienced. So I asked Dale to experiment with me.
Okay, so we're going to do muscle testing now to show that there is a weakness in the body in certain areas, and we can affect a change with the crystal. So if you'll hold your hand this way, first let me test it. Okay, resist it. That's good. Very good. Now take the 3 fingers of your left hand, touch first your forehead, your brow. All right, that's strong. Now touch your throat. That's a little weaker. Now down the chest for the heart. That's the weakest of all. Okay, let's go lay down now and we'll work on it.
Walker said he noticed a weakness in my heart area, the emotional center of the aura. He wanted to correct the psychic energy imbalance by working with the crystal.
All I'm going to do is I'm going to move my hand with the crystal over your body, but not touching your skin, just interacting with the energy system of your body.
At first, I didn't feel anything, except that it was nice to relax for a while. Walker moved the crystal over my body, focusing its energy over my psychic centers. He never touched me. He said he was attempting to get all my energy flowing in the same direction, like a stream of consciousness. I began to feel very relaxed, sleepy, but clear-minded. My eyes were closed, but I could sense when Walker stepped away from me or withdrew the crystal. I did not have any other sensation, no tingling, just a warm, secure feeling, a peace.
Basically, I use a crystal as a tool to get in touch with the subconscious mind, to program the subconscious mind to send energies into specific places or focusing, because the subconscious mind does control all the physiological functions of the body. We know that. So what we're trying for is to direct the energy to go into that area so the natural healing process of the body takes over, takes that extra energy, and begins the rebuilding process.